Colonel Randall Larsen, United States Air Force retired, is the National Security Advisor at the Johns Hopkins Center for Health Security and a senior fellow at the Homeland Security Policy Institute at George Washington University. He is my friend, Jim Talent's go-to guy. He told me to get the Colonel. And good morning, Colonel. Great to have you on the Hugh Hewitt Show.
Good morning, Hugh.
What is the significance of domestic transmission of coronavirus in Japan and Taiwan?
Okay, the Chinese director of public health said 2 days ago that there was human-to-human transmission. The Center for Disease Control in the United States said they couldn't confirm it yet, but it certainly sounds like that's what we're seeing now. People have returned from China carrying this disease and then gave it to someone in their home country, Taiwan and Japan, which means that this is eerily similar to two exercises we did at Johns Hopkins University Center for Health Security. Senator Jim Talent played in one in May of 2018. We recently did one in New York City in October of 2019, and that one was eerily similar to what we're seeing right now. It starts with just a handful of cases in a few countries where a coronavirus did a genetic shift, and all of a sudden it went from animals to humans. And first reports in these exercises were, there's only 6 or 7 countries that have it, a handful of people. But with geometric progression, how quickly within a week or two that can spread. The exercise we did in New York City last October was focused on the economic consequences of a pandemic. This has all the elements of that. In the exercise we did, 65 million people eventually died in an 18-month period, and the global economy took an enormous downturn because people become afraid to move around. They don't go to work. It's a very serious potential. Doesn't mean it's going to happen that way, but everybody in the healthcare industry is very concerned about which way this could go.
Now, Colonel Larsen, in the model that you did, both this year's and last year's, or last year's and 2018's, did the governments get up and running with their interventions, and do you believe the United States has begun an adequate amount of intervention and public transmission and transparency as to where the patients are and how they entered the country?
Basically, no. You remember how it was in 2014 with Ebola? There was so much confusion and information put out. Hospitals were not prepared for it. We did not have enough isolation wards. In 2014, when Ebola came to the United States, I think it was 6 cases, we only had 100 adequate isolation beds in the entire United States. That number is not significantly higher today.
Now we
cannot do just-in-time response. We are not prepared today. It can't be, we're just going to spend a lot of money today. This is something you have to prepare for years in advance, and Senator Talent firmly believes that. He's worked in this field now for 6 to 7 years looking at our public health as a national security issue. You can't just wait till there's a pandemic and then start spending money.
Now, Colonel Larsen, I've been asking one question over and over again. There are 5 confirmed cases of Wuhan coronavirus in the United States. 2 are in Southern California, where I'm talking to you from this morning. I am curious, is it incumbent upon the government to tell us the flights upon which those individuals traveled, their ports of entry, and any public movements they might have had? Not the names. I don't want to know their names. I don't want to know their hospitals. I don't want panic. I just want people to self-monitor and report if they get sick.
Absolutely. Transparency is one of the most important things. People, if I was on that flight, my family and I, my wife, my daughter, and my son-in-law just flew home from Mexico last night. And if we hear today that there was someone on that flight, there was a guy sitting next to my daughter that coughed the whole flight. 2 people across the aisle had masks on. If somebody gets sick on that airplane, I should know. My family should know. And the other thing, Hugh, if you're sick, it's this American culture we have. I'm going to go to work even though I'm sick. If this thing really starts spreading and you get these symptoms, which are like a common cold, it starts with a dry cough, a little bit of fever, don't go to work if you're sick.
Yeah.
That is the That is the best thing citizens can do to prevent a large-scale pandemic.
So, Colonel, as you watch the progression of coronavirus, and again, the domestic transmission reported this hour in Japan, the domestic transmission reported in Taiwan are major milestones because it means that someone who left China gave it to someone inside those countries who had not been to China, which who knows what that means. If it gets to Africa or an underdeveloped part of the world where there are absolutely no procedures in place. I think of one of the large refugee camps of Africa, et cetera. What does your modeling show?
Well, in both exercises, 2018, 2019, the countries that were worst hurt were those third world countries where the public health infrastructure basically does not exist. Governments tend not to communicate to the population with honest facts. There's no transparency. And I will tell you, in the past, in some of the flu pandemics, China did not release all the information they should have. I think there was concern that tourists will stop going to China if they release it in some of the previous flu pandemics. It appears now that China is being a little bit more transparent, but I don't know if they're giving us all the facts.
Now, at what level?
Citizens of all countries deserve to hear the facts as they know them. And they could change every day, but we need to know what our government knows on a daily basis.
I had my friend David Bonson on earlier. He manages a lot of money, and he urged people, no panic buying, no panic selling in the markets. Did you do any buying or selling yesterday, Colonel?
Absolutely not. And all my kids know that they got to be long-term players in the stock market in a very diversified portfolio. I mean, what, it fell almost 500 points yesterday. Nobody in my family lost any money because we didn't sell anything.
So don't run off and get crazy. I want to stress, we're not at a panic point. We're not even close. When would you hit the panic button?
I've never seen a scenario. Maybe the Cuban Missile Crisis would be the closest I would think of. I'm just telling you, if the way to make money in the stock market is be a long-term player with a very diversified portfolio and hang in there through the ups and downs. I had friends that panicked in 2008 and 2009, and remember the stock market came back double. Just relax on that.
Agree with that. No, but what I want,
any fever or cough, talk to your doctor, but do not panic in the stock market.
I wasn't talking about the stock market, Colonel. I was talking about when will you, as a national security professional, panic about the United States and the spread of coronavirus? What is a signal that would tell you that we failed to contain?
You look at Toronto in the SARS epidemic in 2003. Is when they almost had to shut down the hospitals. That's a time of panic. Remember, Hugh, a lot of people working in hospital are single parents. Now, imagine you're a single parent. You got 3 small kids at home. There's a contagious disease patients in your hospital. There's no vaccine and there's no treatment. Are you going to go to work and then go home and infect your children? That's where I get very nervous. I don't know if I'd use the word panic, but that's where it gets serious, is when our healthcare workers get infected and then they stop coming to work.
I have seen stories in China where some of the doctors involved in the treatment have themselves become ill. At least one of them has died. Have you been following those reports, Colonel Larsen?
Well, absolutely, because we've seen that with SARS, which was a coronavirus similar to this. SARS, back in 2003, it was the healthcare workers that were primarily infected. Now, Hugh, there's one big factor here we have not seen yet. How contagious is this? Some diseases are incredibly contagious, like measles, which is why the vaccine is very important. If I'm in a hotel room and I have measles and I'm there for a day and then I leave, you come into that hotel room 3 hours later, you can get measles.
Wow.
That's incredibly contagious. SARS, thankfully, was not very contagious. Primarily the people that were infected were the family members who were caring for sick people and medical personnel at hospitals. We don't know yet. Nobody knows how contagious this is. How easy is it to get it?
How do we not know that?
The real key.
Why don't we know that? It's been a week. Why don't we know that?
A week's not enough to gather all the information. You can't do a blood test and determine how contagious any disease is. It's how many times, how do we track it back. How the epidemiologists say John Smith got it from Betty White. That those cases in Japan now, believe me, the epidemiologist is going to be tracking it. And the other key is if it's primarily healthcare workers are getting sick, that's an indication it's not very contagious like SARS. But if they find that somebody had it on an airplane and a third of the people on that airplane turn out sick, that gets very scary because that would tell you it's highly contagious.
Last question, Colonel Larsen, please come back. We are watching 100-plus people in the United States. I don't know why. They haven't told us if they were on airplanes, whatever. And we are bringing a plane load of people first to Alaska, then to Ontario, California from Wuhan. They'll be screened at both places. If the incubation period is 10 days to 2 weeks, will that actually tell us anything?
What are you going to do with those people when you get back to Ontario, California? For instance, last night, if they would have quarantined our flight when we landed in Houston, what are they going to do? Put us in isolation somewhere for 2 weeks? How about my daughter and son-in-law? They're nurses. They got to get back to a hospital. Who's going to pay them? Well, the government's putting them in a place for 2 weeks. It's easy when we bring military troops home and we think they've been, we just put them up here at Fort Hood, fine, they get paid, whatever. But there's so many legal issues about how you would quarantine or isolate those people that we're bringing out of Wuhan. Who's going to pay for them? Who's going to care for their kids that may be here? A lot of challenges there, and that's why we have those exercises to try to ask and answer those questions in advance.
Colonel Larsen, keep
answered yet.
Keep coming back because I'm sure you're working the problem every single day. And